From birth, young children are natural explorers. But as parents, there are some things we hope they never discover, such as the physical and emotional pain of a childhood disease like rotavirus. But what is rotavirus? Well, it's no one's best friend. It's a clever character, lingering on mucky hands and jumping effortlessly between children's bodies, as well as the toys they're playing with. As a new parent, you may be given advice on how to avoid inviting rotavirus into your home. Hand washing can help prevent transmission, whilst breastfeeding your child can provide some natural protection. But even with these precautions, almost every child is infected by age 5. Take your typical family. Rotavirus usually makes an appearance in the cold season, entering the body through the mouth. Once it infects the digestive system, the results are worrying and often frightening. Vomiting and diarrhea, as well as fever and even dehydration. There are no antiviral medications to treat the disease, so the best thing you can do is to try and rehydrate your child as much as possible. This, however, can be especially difficult to administer to small children, potentially leading to more serious complications. Since nobody wants to watch their child suffer with some distressing physical symptoms, trips to the doctor or an outpatient clinic are common. The most serious cases will involve multiple appointments and require a hospital stay of 3 days on average, which means that not only do you have a sick child, but you have to deal with huge interruptions to everyday life. In addition to the worry and anxiety caused by seeing your child suffer, you might also have the added stress of juggling work commitments, as well as worrying about the economic impact of medical costs and missed days of work. Is it any wonder, then, that many parents are left feeling physically and mentally exhausted by rotavirus? So how can our family be better protected? The most effective method is to avoid infection in the first place, making vaccination your best defense. How does rotavirus vaccine work? Vaccines boost the body's natural defense system, allowing it to produce antibodies that can fight bacteria and viruses. A child who has been vaccinated early against rotavirus is better able to fight it, if they happen to come into contact with it. The World Health Organization recommends that the rotavirus vaccine is given to all babies, because those countries which include it in their national immunization program have significantly lower levels of the disease. The earlier you take steps to protect your child, the better chance they have of avoiding a more severe attack, which, as we have seen, has to be good news for all the family. Talk to your doctor about protecting your child against rotavirus.